Good morning. Um, Here we are with a new chapter, and this one is 4.5, and it's about the use and abuse of substances, chemical substances, which has become rife in our country these days. So it behooves us to get some sort of handle on where these drugs are and certainly where they come from, and some of the effects for those of you who are leaning towards being in law enforcement or in um, nursing, or in particular in teaching, particularly the lower age groups, or younger age groups, I should say. Your chapter in the book has a diagram that I really like, and to summarize, it has an antipsychotic Haldol, which is used primarily for schizophrenia. But then if you look farther down on the diagram, it has three colored circles: yellow, green, and blue. Yellow being stimulants, green being depressants, and blue being hallucinogens. If we look at the stimulants to start with, we have to have some respect for them. The two that are primary these days in our circle would be amphetamines and cocaine. Amphetamines are very easily made on the Big Island, for example, in lava tubes. As part of the manufacturing process, ether is used, and the smell from a cookout for amphetamines is disgusting, to say the least. But there are people who can put up a lab, make a supply for a month for about 2 or 3 people, and take it down within an hour. And so 3 hours will accomplish their deed. Cocaine is another stimulant, and that comes primarily from Peru with plants, the cocoa plant, above 10,000 feet. Cocaine's been around a while, and it is really a pure stimulant. Really doesn't have any analgesic effect. It does have some depressant effects if used in overdose. And so from that standpoint, it can be dangerous. You'll find I've picked a celebrity as we go through these drugs, and the celebrity for the cocaine group is Whitney Houston. She was known to use cocaine quite a lot, particularly in the latest days of her life. And she had a birthday party and needed to get washed up, and so she decided to have a bath in her beautiful bathtub in her home in Los Angeles. She was filling the bathtub with water. She had used some cocaine earlier in the day, and she had a glass of champagne, and it may not have been her first, and she was going to have a bath. One of the things that substance abusers need to be aware of is that water can be dangerous as well, because what happened, she slipped into a nice warm bath and was beautifully analgesic with her alcohol and nicely stimulated with the cocaine, and as a result she rolled over in her bath and drowned. A sad end to a beautiful singer. If we go to the next group, the very dark green, although it says minor tranquilizers, they can be heavy tranquilizers. And we see in that group particularly Ativan and Valium, which are both common medications used in medical practice. You need to add to that list a drug called Versed, which is an analog of Valium, which has marked amnesic properties, and propofol. Propofol is an IV anesthetic, IV sedative. Both of those last two drugs, Versed and propofol, are used in anesthesia practice. And this is where I state that both of those drugs are hospital drugs. They should not be used in the private setting. The reason is that they have marked respiratory depression properties which stop breathing in the patient. In the hospital setting, and an anesthesiologist on board, you can very easily substitute for respiration by ventilating the patient. Our celebrity for this group was, of course, Michael Jackson, who in 2009 was preparing for a 50-date concert tour at London's new stage area. And it was much like the Colosseum, except it was it had a roof. Now, he clearly was stressed out and had been for several days, and he clearly was having a problem with sleep. Unfortunately, he had a cardiologist as a physician who was dabbling in the use of anesthesia drugs, which Michael had got for him. To say the least, this is a bad scene. Anyway, on his last day, Michael was given Valium at about 12 midnight, and he was still not asleep at about 2 or 3 in the morning, and his physician gave him Ativan. He was complaining bitterly at about 5 or 6 o'clock in the morning, and he gave him some Versed. Now remember, Versed is amnesic, and is a very good amnesic. I have a story about that, but I'm not going to tell you now. And about 10 o'clock in the morning, he started propofol. And very soon after that, he was dead. The point here is that all of those 4 drugs that Michael took during those last 10, 12 hours belong in that very dark circle that you see headed by Ativan. Another sad, sinking loss to the abuse of, some of them are medications, but then were used in a substance abuse environment. The next group I want to deal with is alcohol, and to a lesser extent barbiturates. Let's just stay with alcohol. Alcohol, of course, is available to most if you're of an age, and it's freely available 24 hours a day in most states and most cities. It's also available in most homes. For those of you who are movie buffs and who like Westerns, you will remember that 200 years ago or so, alcohol was used very often when surgery was necessary, such as amputation or closure of wounds, and even for some surgeries. Alcohol is really a mild depressive. It's not as good as Valium, for instance, in the last group that we talked about, but it does have analgesic properties, so that the patient is still breathing on their own despite a large dose of alcohol. And procedures can be performed, such as amputation or closure of wounds, or even major surgery for that matter. If you look at the a little farther down, ether, once again, this is a beautiful analgesic also. It's an ugly drug. I used it many times earlier in my anesthesia career. I had it for my appendix when I was aged 8, and I remember it vividly. It's ugly. Our celebrity for this drug is the comedian Robin Williams. Now, Robin had been an alcoholic for many years. Before he died in 1914, he'd been almost 30 years in recovery. And he had realized that he had Lewy body dementia. The Lewy body is a name that was given for the Parkinson-like syndrome that develops in these patients. And the dementia just means loss of your mind. And Robin became aware, as did his family, that this dementia was beginning to creep ever closer, ever closer. He was clearly upset by this, and I understand why. And so in 2014, he took his life and hung himself. Our next group are the narcotic analgesics that you see at the bottom of the slide. And this is probably the perfect substance abuse drug. We need to add fentanyl at the bottom, being another analgesic. It's really a medication and should only be used in the hospital setting. Um, I have to tell you that some of the mixtures that are coming up from Mexico in the way of heroin is also mixed with fentanyl, which now is very easily made on the substance abuse markup. Fentanyl used not to be able to be available to the general public, and as I say, once again, it should only be used in the hospital setting. However, our celebrity for this group would be Prince. He had maintained for many years that he was not taking any drugs, and in reality probably wasn't until he had to use OxyContin. Some of his antics on the stage left him with a damaged hip, and at least one of his ankles was damaged too, so that when he was standing, he was in constant pain. He had moved from OxyContin to someone who was providing him with fentanyl. Fentanyl as a patch is used in cancer patients. The patch lasts about 3 days. It gives analgesia of a limited nature to cancer patients who have pretty excruciating pain when they come towards the end of their life. What's interesting about Prince is that after a concert he was flying back to Minnesota, and the plane had to make a stop somewhere in the Midwest because Prince was found to be unconscious. We now know that unconsciousness was due to an overdose of fentanyl. He was taken to a hospital, and the emergency physicians there gave him Narcan, which is an antidote. Actually, it's an antidote for morphine, heroin, and fentanyl, and to a lesser extent, codeine. And he must have woken up and said, well, I want to go home. And anyway, there wasn't a bed of a suitable variety at this hospital because it was small. So he elected to go home, back to Minnesota. Narcan really only lasts about another 4 or 6 hours at most, and later on, and I'm not sure of the time frame, he either must have taken another dose of fentanyl or gone to sleep and then taken some more and was found in an elevator dead. He died as a result of a fentanyl overdose. And it shows, even to the practiced user, that fentanyl is an extreme respiratory depressant. One of the nice things about morphine and heroin is that both of them provide analgesia, which is why it's used, particularly morphine, is used in surgical situations. The euphoria is just wonderful. I can attest to that. And it does have some sedative properties. And in a large dose situation, those sedatives properties appear as marked respiratory depression. What do I mean by that? You're not breathing very fast. So if we go on, we look at the blue circles, and here we have the strange place of marijuana. Now the agent in marijuana is THC. And for those of you who are unaware of some of the properties of marijuana, if you smoke marijuana and you get THC in your bloodstream, it will last for about 28 days. And the labs these days are sophisticated enough so that THC can be detected in your bloodstream. Now, there's been a change in the marijuana over the years. In the 1960s, when marijuana was a really very well-used drug, the THC concentration was about 3%, maybe 4% in some varieties of the plant. Over the years and into 2014, 15, and 16, the Western European chemists, primarily the Dutch chemists, and horticulturists have been able to produce hybrids of the marijuana plant that produce at least 15%, and some claim 20% THC. Now, this takes marijuana out of the recreational state into being a highly lethal drug, much like heroin. And in actual fact, this is the way the Dutch authorities and their narcotics bureau treat marijuana these days, as being very close or equal to morphine or heroin. You'll notice that in our diagram, it's yellow, being a stimulant. It's green, being a depressant. And in overdose situations, the blue part comes in for hallucinogens. So let's look at the rest of the group of hallucinogens, which you should regard, for the most part, as being recreational drugs. MDMAs or date rape drugs are unfortunately very common. They are used in social situations, particularly in dating situations where the male is able to add some to the drink of a female so as to make her acceptable to sexual advances, which is a polite way of saying date rape. MDMAs and date rape drugs have very marked amnesic properties, which for this sort of activity make them ideal. Going down the list are the various mushroom chemicals. LSD is not a mushroom. It's a drug that was made in the 60s. Was used very minimally as a medication. In the purest forms, it is a very, it's a decent medication. But the hallucinogen properties made it not very acceptable as far as patients were concerned. You should note that LSD, when made in the private sector, may have over 200 different sorts of impurities in it. If we hop over to the dissociatives, what that really means is that any of these drugs, when given appropriately, are in fact medications. And the word dissociative means my mind is separate from my body. And that can be used to advantage in certain situations. Ketamine is a drug that really can only be used in children under the age of 10. It was used in Alaska in particular, where there are huge numbers of patients who have dental problems and teeth have to be extracted. If the appropriate dose of ketamine is given to a child, you can take out 2 or 3 teeth very easily with them being very comfortable. And of course it is an amnesic as well. The purest form of PCP I used for a number of years in my anesthesia practice. And it is a powerful antiemetic and lasts a long time. And so I used it in my obstetric practice, particularly for C-sections, where on the operating table you don't really want the patient to be vomiting. And also there are parts of the C-section that you don't really want the patient to know anything very much about. So that's why I used it. They had a very smooth recovery period into their own bed on the ward, and woke up half a day later or so and were able to sit on the side of the bed and put their feet down and not be nauseated. One should remember that the best part of 40% of any female patient or group of female patients who have anesthesia or sedation of any sort will get nauseated and vomit. And so it's a common feature of female anesthesia. Males is much less, less than 5%. Some people say it's 2%. Nitrous oxide is a gas that we use in anesthesia, less today than it was 30 years ago, but I broke my anesthesia teeth on nitrous oxide in those early days in the 50s. So then we move on to the last slide, where we have all of those slides that we had looked at individually. The antipsychotic Haldol, which is out there on its own, being very much of a loner. The stimulants, which are in the yellow circle, and the depressants in the green circle, and the hallucinogens, which should be regarded as more or less recreational drugs, in the blue circles. So this concludes my presentation of the drugs, chapter 4.5. I wish you well.